Hello and welcome everyone to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about colon cancer, otherwise known as colorectal cancer. We're particularly going to be focusing on the signs and the symptoms. We're going to do a brief little introduction, and then we're going to dive right into the signs and symptoms and really focus on that in this video. So let's get right into it. Unfortunately, it's so common and it's affecting people younger and younger. A few high-profile cases over the years. I mean, one that strikes my mind right away while making this video and recording was the Black Panther, for example. So yeah, lots of problems with colon cancer. So let's get right into it. A colorectal cancer can affect basically any part of the colon, the large intestine. So beginning with the cecum, the ascending colon, and then we move upwards into the transverse colon, and then we go around back down, which is the left side of your body when you look down on it. That's the descending colon, and then we have the sigmoid colon, and then finally at the end we have the rectum and the anus. And keep the anatomy in our minds because that's going to be a very important part of the video, because location will matter of where the tumor is. And generally what happens here is that the malignant growth comes from another growth, meaning it comes from a polyp, not to be confused with diverticula. We'll talk about that in a sec, but it comes from a polyp. It's the third or fourth most common cancer worldwide. Lifetime risk is 1 in 15 for women and 1 in 19 for men, unfortunately. And once again, keep the location in our minds because where the tumor is plays a role in explaining some of the symptoms. But we also must keep in mind that it may be asymptomatic. So that's the very, very important thing here. And it's not a diverticula, it comes from a polyp. So think of diverticula coming right from within the lumen, and the polyps are from the outside. So you may have missed what I've just done, but I've shaded in the borders there. So the polyps are from the outermost side and the diverticular from the innermost side generally. And now let's move on to the signs and the symptoms of colorectal cancer. So they're going to be primarily based on the location of the tumor, but nonetheless, when we have a tumor, we're going to have abdominal pain, we're going to have bloating and distension of our belly, and we're going to have an abdominal mass there perhaps as well. So let's break down each of these. So abdominal pain, again, it depends on the location, and this location then causes pressure. It can cause a physical obstruction within the bowel as well, and it can also spread and invade into other structures, which is something to keep in mind. Unfortunately, colon cancer can sometimes be caught quite late, and it's asymptomatic until that point. Bloating and distension, it depends on the location, once again, and what it is due to is an increased volume of air and gas. So that's very important to note here. And when we're talking about an abdominal mass, so when we're talking about an examination of the abdomen, we made a video on that as well, but it depends on the location again. These are the quadrants of the abdomen. We can split them up into 4 quadrants generally, and usually it's a palpable mass in the right lower quadrant at times. It can be other areas as well, but if you feel a mass there, that's trouble. That's a big problem. So those are some of the signs and symptoms. Now let's move on to some other ones as well. And a lot of these other ones now have to do with going to the actual toilet and what we see there, unfortunately. Again, it depends on the location of the tumor, but the main thing we're dealing with here is blood in the stool and what that does to us. So what does bleeding, when we see blood in the stool, what does that mean? It can be hematochezia, which is bright red blood in the stool, meaning that the tumor is more so on the left side because it's fresher blood, or it can be melena, which is dark, sticky poo. And that's because it contains partially digested blood. That's because the tumor is higher up in the large intestine and the blood is there for longer. And what does bleeding do? It causes anemia. So why anemia occurs? Well, it's due to the blood loss from the bleeding. Losing too much blood leads to a lack of iron, which we need, and then we get something called iron deficiency anemia, which is a whole video on its own. But ultimately, then what we get is signs and symptoms of iron deficiency anemia. So that can cause weakness and fatigue, but weakness and fatigue doesn't just have to come from the anemia, it can come from the actual cancer and the tumor itself. So this is something really important to note as well. So it can come from both sides. Now let's move on and talk about a few more symptoms and signs. And here what we're talking about are 4 things. So when the bowel isn't moving, when there's no bowel movements, when there's pain and distension, this can occur as well. When you cannot pass gas, when you can't fart at all, this is all attributed to right-sided colon tumors as well, sometimes left as well, but they can provoke nausea and vomiting. And what are these signs and symptoms the hallmark of? If you guessed it, it is constipation and eventually obstruction. So if you have a lot of these features, that's a problem. Another thing that can occur is tenesmus. So that's the feeling or the sensation of the urge to defecate. You can also have the sensation of incomplete evacuation. So this is something that can occur as well in patients, not just colon cancer, but also IBD and things like that. And finally, what we have is weight loss in this situation as well. So the cancer slowly eats away, the cancerous growth eats away, and it causes weight loss. So that's a big problem as well. And finally, now let's talk about the actual stool changes and the bowel habit changes. What we have here is an alteration between diarrhea and constipation. Both can occur depending on the location. Another thing that you can see also is what causes a diarrhea formation or constipation formation is if you have a physical obstruction there. So sometimes on an examination, when you're examining the rectum, you can actually feel a lump there. And of course, if the stool has to bypass that, it causes a change in the bowel habits and the change in stool as well. Something that we need to discuss also is the shape of stool that can occur. So you can have diarrhea, you can have constipation, but you can also have pencil-shaped stools. This again is not specific to colon cancer, but it is a strong feature of it. Something to consider here is probably what you've heard of often as well is something called the Bristol stool chart. So it's good. Quite often it's good to take a look at your own stools and see what's going on there and see if there's a deviation from the normal. So if there's a deviation, that's a problem. And the final feature is metastatic disease. So it can spread to other organs, and that's a huge problem. So if there are features like this, please see your doctor. I mean, a lot of these signs and symptoms, they can mimic signs and symptoms of other diseases. There's another video that we made that highlights what the combination of certain symptoms are that are really red flag symptoms and signs. You can take a look at that, but the moral of the video is that if something is different going on with you, whether it's your bowels or systemically, so you're losing weight or anything like that, you have to see your doctor and get things checked out. Nowadays, there are certain tests that you can do. They're quite easy. They can check for blood under the microscope in your stool. There are certain tests that you can do. Older people get screening colonoscopies in westernized countries, for example, and there's a lot of good things that are being done. Hope you learned something. Like and subscribe for more. Leave a comment in the section below, and we will see you in the next video. Take care.